What causes autism? The exact cause or causes of autism spectrum disorder, ASD, are not fully understood. Autism is a complex neurodevelopmental disorder that affects social interaction, communication, and behavior. However, research suggests that a combination of genetic, environmental, and neurological factors play a role in its development. Here are some factors that have been associated with the development of autism. Genetic factors. There is strong evidence of a genetic component to autism. Many studies have shown that certain genes and genetic variations are associated with an increased risk of developing ASD. However, it's important to note that there is no single gene responsible for autism. Rather, it appears to involve the interaction of multiple genes, which may contribute to a vulnerability or predisposition to the condition. Environmental factors. Certain environmental factors have been suggested as potential contributors to autism, although their precise role is still being investigated. These factors may include prenatal influences such as exposure to certain medications, toxins, or infections during pregnancy. However, it's important to note that the vast majority of environmental factors studied so far are only associated with a small increase in autism risk and do not directly cause the condition. Neurological factors. Abnormalities in brain structure and function have been observed in individuals with autism. These may involve differences in the size and connectivity of certain brain regions, as well as atypical patterns of brain activity. However, it is not yet clear whether these neurological differences are a cause or a consequence of autism. Advanced parental age. Studies have found a higher incidence of autism in children born to older parents. Advanced maternal and paternal age may be associated with a slightly increased risk of autism, although the overall risk remains relatively low. It's important to note that vaccines do not cause autism. Numerous scientific studies have debunked the claim that vaccines, particularly the measles-mumps-rubella, MMR, vaccine or thimerosal-containing vaccines, are linked to the development of autism. The weight of scientific evidence strongly supports the safety of vaccines. It's also worth mentioning that autism is a highly heterogeneous condition, and there is significant variability in its presentation and severity among individuals. Each person with autism is unique, and the underlying causes can vary from person to person. While the specific causes of autism are still being investigated, early diagnosis, intervention, and support services can significantly improve outcomes and quality of life for individuals with autism spectrum disorder. If you have concerns about autism or your child's development, it is advisable to consult with healthcare professionals, such as pediatricians, psychologists, or developmental specialists, who can provide a comprehensive evaluation and appropriate guidance.